Ethical and legal issues associated with undertreating geriatric dental patients may go unrecognized by many. Due to the lack of education, caregivers and family members may not understand the risks involved with undertreatment. In a long-term assisted living setting, the increased health risks can create detrimental, ethical, and legal consequences as a result of undertreating the residents. By understanding our profession's code of ethics and California law, one can obtain the knowledge necessary to solve this type of dilemma. Devin is an RDHAP and provides dental hygiene services to the residents of several long-term care facilities located in the San Francisco Bay Area. One of the residents, Mr. David Callahan, has been receiving dental hygiene services from Devin for 5 years. 2 years ago, Mr. Callahan was diagnosed with Alzheimer's disease by his primary physician. Since that time, Devin has noticed diminished oral hygiene and overall health proven by her clinical assessments. Devin noted an accumulation of heavy plaque and calculus, aggressive periodontal infection, and rampant decay, especially on the root surfaces of most of his remaining teeth. Mr. Callahan is no longer able to provide self-care and relies on the staff of the care facility to give him oral hygiene. Devin provided the results of the assessments to Mr. Callahan's family. The family stated that they were more concerned about Mr. Callahan's caries because they understood more about dental decay than they did about aggressive periodontal disease. After Devin explained the risks, benefits, alternatives, and costs associated with the appropriate care, Devin referred Mr. Callahan to a local dentist to address the family's chief concern. Devin learned that the dentist planned to only restore the maxillary anterior teeth because those are the teeth that show when the patient smiles. The dentist stated he would do the procedure with the patient under general anesthetic and was not planning to alleviate the periodontal infection. The dentist was not supportive of Devin's recommendation to provide better oral hygiene on a daily basis due to Mr. Callahan's age and medical status. Devin does not think Mr. Callahan's medical status and age justify undertreatment. Despite his condition, he is entitled to receive the standard of care and to be treated with justice and fairness. She becomes concerned about the preservation of Mr. Callahan's individual autonomy and human rights. Upholding his dignity does not justify undertreatment. Older adults face many barriers when trying to obtain a standard level of oral health. The dental professional needs to understand the complexities of older patients and what special needs they may have. Many physical, psychological, social, and economic aspects must be well understood in order to provide satisfactory treatment within the standard of care for these patients. Infrequent and inadequate self-care directly relates to an increased susceptibility to periodontal disease. Dental diseases have a negative impact on general health and the quality of life for those in the geriatric age group. In order to maintain optimal oral health, older patients need appropriate oral care instructions from dental health professionals. Alzheimer's disease is a progressive disease that destroys the area of the brain that control memory, mental, and social functions. Over time, memory loss is prominent, as well as decline in personal hygiene. Periodontal disease is the direct result of an interaction between dental plaque biofilm and host defenses. Mature plaque biofilm contain large numbers of gram-negative anaerobic bacteria that stimulate a host response, resulting in destruction of the alveolar bone and connective tissue. The bacteria from the oral cavity can travel through the bloodstream, reach the brain, and either initiate or exacerbate existing lesions. In reference to the case study, the core values of autonomy and justice have been violated, as well as the standards of professional responsibility, as noted in the American Dental Hygienists Association Code of Ethics. In regards to autonomy, the healthcare provider is to help an individual to make the best choice possible. Healthcare providers are obligated to provide all of the options for care, including risks, benefits, and cost for possible procedures. Justice and fairness are values that support equitable distribution of health care, and that all people, regardless of their age or health status, should have access to high-quality, affordable oral health care. It is unethical for a healthcare practitioner to undertreat a patient because they are elderly or do not have a large financial capacity. Legally, a dental hygienist has an obligation to report patient neglect. California law states that elder abuse includes physical abuse, neglect, financial abuse, or other treatment resulting in physical harm, pain, or mental suffering. According to the Dental Practice Act, it is unprofessional conduct for the healthcare provider to knowingly permit grossly negligent treatment as determined by the standard of practice in the community. Dentists have a concurrent ethical obligation to promote the welfare of all patients. There are always options to solving ethical dilemmas. The issue of undertreatment is no different. Dental professionals may be challenged with ethical issues such as this throughout their career. After considering all the options carefully, Devin decided to initiate a discussion with the dentist about the importance of treating periodontal disease and the detrimental effects periodontitis may have on the progression of Alzheimer's disease. Devin provided the dentist with evidence-based research, the code of ethics, and pertinent laws. Because of that discussion, the dentist was able to make an informed decision about how to treatment plan for Mr. Callahan. With the understanding and support from the dentist regarding periodontal treatment, Devin and the dentist presented a new treatment plan to Mr. Callahan's family members. They explained the importance of treating the periodontal infection along with restoring the maxillary anterior teeth. To help Mr. Callahan maintain oral health, Devin has begun to teach the caregivers in the long-term care facility what periodontitis is and how to brush teeth properly, improving their residents' daily oral health. By convincing the dentist about the importance of treating periodontal disease, the dentist will treat patients in the future with the standard of care expected. In the end, let it be known that Devin did not compromise her ethical obligations.